And I want to bring on Vivos Therapeutics co-founder and CEO, Kirk Huntsman. Kirk, nice to see you here.
Hi, Brent. Nice to be here. Thanks for having us.
Yeah, and it looks like your CFO, Brad, is also here. Nice to meet you, Brad. Nice to see you.
Yeah, good to see you, Brent.
Cool. Well, I will let you guys have at it. I see some slides backstage, and whichever one of you guys is controlling that, just make it full screen if you can, and we should be good to go.
So I thought I did. Let me make sure. How does that? Does that look full screen now?
No, not yet.
In presentation mode, I think.
It's showing presentation mode on my computer here, so I don't know why not.
The gremlins.
Let's see here.
You can always blame the gremlins, guys.
You can't see. I'm showing full presentation mode. Can you guys see these changes?
Nope, it's not changing on our end here, Kirk.
All right, hold
try to stop the share and then reshare your screen. Let's see what happens. We'll give it a good old restart.
All right, hold on a minute here. Stop sharing.
There you go. Try again. And I mean, it's nice to have the full screen, but worst comes to worst, we can look at the little side panel over there.
All right, how does that look? Do you see it now? And
I see it. I see it backstage. It's not full screen still, Kirk, but that's fine. I think it's okay.
It's showing full screen on mine. Sorry about that. Well, let's get started.
Good. Yes.
All right. So we are Vivos Therapeutics. Thank you for joining us today. Are you seeing the just so that I'm clear, are you seeing the first screen here?
I see the first screen. It says Vivos. Why are so many people suffering from OSA?
That's actually a different screen. I'm not sure why.
That's the solution I think we need here. Kirk, can you share the other screen?
Yeah, that's what I thought I did. Hold on a second. Sorry.
We'll give it one more try here.
Sorry about that. I must have two versions of this open somewhere. Let's see. My bad.
All good, Kirk. We're in this together, man.
Now I got to find where I put it here. Well, that's weird because on my computer it only shows one thing. Let me reopen it here and I'll just redo it again.
No problemo.
All right, so let me share again.
Sounded like good news.
Well, we had it all teed up. I'm not sure what's going on here. All right, do you see it now?
I see it now, and I guess you're just going to have to click through that way if you don't mind, Kirk.
How about that? Did it flip over to presentation mode?
Nope, it didn't. It's okay.
All right, let's go.
Let's on slide one though. So
we won't waste time.
We'll make it work.
So you're on slide one, so you can see this here. So we are Vivos Therapeutics. We appreciate the folks at Benzinga for hosting us here, and we have a really interesting company with a very, very innovative, disruptive technology that we're bringing to market. We are a market stage medical technology company. We address the market for obstructive sleep apnea. For those of you who may, just by way of refresher, if you don't know much about obstructive sleep apnea, it is one of the most pervasive diseases in the world. It affects over 1 billion people with up to 80% or more undiagnosed and untreated. The thing with sleep apnea is that it's comorbid with so many other chronic health conditions. So we're talking about all of the major chronic conditions that plague mankind: diabetes, cardiovascular disease, fibromyalgia, hypertension, all kinds of mental health issues like Alzheimer's, dementia. In children, it affects their cognitive abilities, their school performance. It affects it in some cases creates bedwetting and other issues, allergies. So sleep apnea is a very difficult condition because of two main factors. There's two issues that we have to address here. One is, why are so many people suffering from OSA? And the other is, why are so few receiving treatment? And the two main factors there is, first, doctors don't know who has it. Traditionally, it is required a script from a physician for a sleep test at an institution or a sleep center, an overnight, what's called a polysomnogram. Nowadays, you don't really have to do that. You can do a home sleep test, but they're still expensive. They're unwieldy, and It's just a cumbersome process to get a full-on diagnosis of sleep apnea. The second issue is that once we know who has it, modern medicine really hasn't been able to fix it. The treatment options are unappealing, they're costly, and they're ineffective primarily because patients don't like the options that are available to them. And we'll go through that a little bit more to show you why Vivos has solutions for both of those issues. Vivos brings to market breakthrough technology in both diagnosis and treatment for mild to moderate OSA. In the upper right-hand corner, you see the technology that we have the exclusive license for the dental market in North America. So we're talking Canada and the United States. And we're taking that sleep image technology to market using our Vivos Score program. And then down below, we have our therapeutic program, which we call the Vivos method or the Vivos system. And this technology is actually another breakthrough technology. We have the proprietary ownership of all the intellectual property for this, the patents, the trademarks, and everything else. So Vivos has an end-to-end solution from diagnosis to through treatment, and innovative and very disruptive technologies in both of those areas. Let's talk about sleep image first. So you see these rings over here. This technology is called cardiopulmonary coupling. Cardiopulmonary coupling was first pioneered at Harvard University's Beth Israel Deaconess Medical Center by Dr. Robert Thomas, Dr. Cleet Kushida, and others. And this technology has now been commercialized by a company right here in Colorado called MyCardio, and they also known as Sleep Image. Their commercial name is Sleep Image. So these rings are up to 98.9% comparable to a full-on in-lab overnight sleep test. There's not anything on the market that can compare with this. It also reduces the cost by well over 90%. So you can get a per night test result for under $10. So this has dramatically lowered the barrier for testing and getting more patients to become aware that they have this condition. So the sleep image technology for us represents the best technology that's available in all of medicine to be able to diagnose and confirm the presence of various sleep conditions such as obstructive sleep apnea. Our core technology is what we call our Vivos system or the Vivos method. And this is an oral appliance therapy that is unique to Vivos, proprietary to Vivos, that actually evokes a morphological change in the airway, the size and shape of the airway. This technology is delivered through this oral appliance. The changes in the morphology take place, and the airway becomes larger and more patent, less prone to collapse. That's the technology we do. We just announced recently the mmRNA appliance, which has an advancement in the hinging mechanisms here, and that technology has been cleared by FDA now for use. So that's very, very good news for us. Has been good news for us for a while. Just so that we're aware, the key metric by which OSA is measured is something called the apnea-hypopnea index. And apnea is effectively the collapse of the airway and the cessation of breathing. When they count the number of times that happens in a given period of time, an hour, and the number of times that happens where it lasts at least 10 seconds becomes the basis for an index. This index, if you have 5 of those events per hour, then you're deemed to be in the mild range. 5 to 15 is mild, 15 to 30 is moderate, and over 30 is severe. So it's a physical count of the number of times that your airway collapses. So obviously, if you have a narrow or collapsible, readily collapsible airway, you're going to have more events and more severe sleep apnea. What we try to do with our technology is get to the root cause of this, which is the airway itself. Take a look at this here. These are two-dimensional representations of what is actually a three-dimensional image that we call cone beam computerized tomography. This CBCT scan is actually a three-dimensional image of this entire skeletal volume. And so what you have here on the left is you have this 30-year-old male who has an airway volume of 13.2 cubic centimeters. Think about that as if he's drinking through a paper straw, or if he was breathing through a paper straw. And then on the right, after the redevelopment of his airway, non-surgically, after a period of time, in this case 14 months, typically this takes about 9 to 24 months. In this case, 14 months, and his airway had expanded sufficiently, and his breathing had returned to normal. And this guy went from severe to back to within normal limits. We do that with some degree of frequency. About 1 in 4, about 28% of the patients tend to go from a severe sleep apnea down to, or mild or moderate sleep apnea down to within normal limits. So we are able to get an impact that's very, very impressive. Nobody else in the world can do this non-surgically. We do it every day. Here's a 73-year-old male, 17 months of treatment, and you see his airway before and his airway after. Again, doubling the size and volume of the airway. The fellow before, this is a 30-year-old male, went from 13 to 26. This particular 73-year-old male from 22 to 46. Our technology works on males and females and all age groups. So we can, if we can put an appliance in their mouth, we can probably treat them. So we have extracted from that prior slide there, we've extracted this individual's airway. So his airway before, from a side view, this first one on the left is a side view, then the frontal view, and then the same side and frontal view. You can see the size change, you can see the volume change. And this patient, not sure if he got completely resolved in this particular case or not, but a very much improved airway and function for his nocturnal breathing. So in the next slide, we've done some published studies. We show an average of about 2/3 reduction overall in patients that have obstructive sleep apnea. We've treated over 22,000 patients that have gone through this process. So this is not especially new or novel. We're actually growing this every month with our new case starts and the number of doctors that are performing this service. So if you look at what the landscape looks like for the competition, about 90% of patients that are diagnosed with obstructive sleep apnea are prescribed a CPAP. There's another 10% or so that go into an oral appliance therapy, and sometimes CPAP patients that become intolerant of their CPAP or don't want to use it anymore, sometimes they'll end up in oral appliance therapy. This type of oral appliance therapy is delivered by dentists, but it's a mechanical repositioning of the lower jaw. This is not what Vivos does. You note here under CPAP and under oral appliance therapy, you have to wear these devices for a lifetime. There's no real end in sight. This is you're 40 years old, Mr. Jones or Mrs. Jones, and you have obstructive sleep apnea. The best thing that we can do for you is get you on CPAP or on an oral appliance that you're going to have to wear every night for the rest of your life. With Vivos, typically 12 to 24 months, they're in and out of treatment. The benefits could potentially last a lifetime. We've gone out about 8 years to look at whether there's regression or relapse. We don't see any. We're initiating some studies to see just how long and how far we can go out. But what we can say so far is that patients tend to go in for treatment and come out of treatment. When they're done, they don't go back again. So it looks to us like there's a lifetime of durability in the benefits of treatment. If patients fail their CPAP or their CPAP stops working over a course of time, or their oral appliance therapy is no longer useful, then the only things left for patients with sleep apnea is a surgical response, similar to an implant from Inspire Medical, where they literally implant an electrical box in your chest, wire up the back of your tongue and your diaphragm, and basically sense when you're having an apnea event, shock the tongue. It's called neurostimulation. Tongue jets out of your mouth or jets forward, comes out, the blockage in the airway is removed. That's called neurostimulation. That's Inspire Medical. If you want to do a comparison between their technology and ours, that's pretty easy to do. But I think most patients would prefer to go through the Vivos process as opposed to having something more radical. And we have now this is available across the country and around the world. So we have here our revenue model, just to go quickly here, but we charge doctors to get through their training up front. It's about $37,000 on average. And once they get trained in this, then they start doing cases. And every time they do a case, we get $1,600 to $1,800. That's very typical. If some of you may be familiar with the Align technology model for their Invisalign product, the invisible braces, we patterned our price points and everything, our margins and everything else are patterned after what you see at Align Technology. It's the same marketplace. It's a similar kind of oral appliance. Theirs is for straightening teeth cosmetically. Ours is for resolving a medical condition. And the training involved in ours up front is a little bit higher, quite a bit higher than theirs. Other than that, though, this is the value proposition to the dental community is pretty consistent with theirs. This is an example of that. So this is an example of what a typical dental practice profile would look like. So a typical dental practice is doing $1 million a year of business. It's going to have a couple thousand patients. They'll have between 600 and 1,000 patients out of that population that will have sleep apnea. So they'll have a $5 to $7 million workload of patients that'll be already existing in their practice, coming through their hygiene department. We use our and I've got one here. This is one of our sleep image devices. We use this sleep image device. It simply goes on a finger and automatically starts up. You sync it up with your cell phone, and then you go to sleep. It's just as simple. There's an app that goes on your cell phone. We have, these things are all easy to use, simple. Those 2,000 patients that'll be circulating through that dental office hygiene program, half of those will probably have sleep apnea. We're currently trending at 47% of the patients being testing positive for OSA. So what happens is those patients who test positive, they'll get a confirming diagnosis from a physician. They'll go into treatment. They'll have a case fee of about $9,000. The treatment will begin. There'll be some myofunctional therapy. There'll be other things that go along the way. We'll monitor. The doctors will monitor that patient with the new rings that we have, and there will be about $3,000 of total cost to the dentist that's providing the service. He'll collaborate with the physicians, but the dentist will make about $6,000. So the ROI for these guys is very, very high. It's very immediate. They love what we've done for them, and it's a big deal. We have insurance reimbursement already, commercial payers doing that. We hope to have the Medicare, final phase of the Medicare approvals ready to announce pretty soon here. And so we have everything lined up where we're actually today billing millions of dollars to commercial payers on behalf of patients that have received this treatment. What we have done here, guys, anybody that's in the sleep business part of medicine knows that that part of the medical care system, the healthcare system, is broken. And so what we've done is create an entire ecosystem centered around the dental office for all patients who may suffer from this condition. We supply the dental office and the medical office with software, with technical support, with billing support, with training, with all of the different things that these guys are going to need with their teams to deliver this in a cohesive, unified, end-to-end solution for obstructive sleep apnea. Nobody's ever done that before. This model is working extremely well across the face of North America. So when we talk about competitive strengths, our company has a true competitive advantage. We're very much on top of this marketplace, and we don't see any technologies out there that can do what we do, that have the clearances we have, that have the research behind it that we have, that have the the advantage in terms of just market penetration, market share, mind share in the professional community. And so we feel really good about our position in the marketplace. We're pivoting now towards going after big corporate groups. That initiative has already begun. We've been training up and are speaking with a number of the larger corporate dental groups, both in the United States and Canada. We are actively pursuing them, and the reception has been extraordinarily good. So none of these big corporate groups have a sleep program. And so all of them are looking for ways to do this. They haven't found anything that's worked yet. Some of them have tried it and failed, but nobody's had the end-to-end solution for them that Vivos has. So this is very well received now by the dental community and the corporate dental groups, and it's being very well received, and we are excited about what the prospects hold there. I'm going to turn some time over to Brad. Brad, take a couple of minutes and talk about our financials.
All right, thanks, Kirk. Just to summarize here, you can see in the middle two columns, 2019 and 2020 full year results. Vivos revenue increased 15% year over year from $11.4 million in 2019 to $13.1 million in 2020. In the right two columns, you can see the 9 months ended September 30th, 2020 and 2021. Total revenue for the 9 months ended this year increased 28%, or $2.7 million, to $12.5 million for the first 9 months of 2021. For the third quarter revenue, that increased actually 38%, or $1.3 million, to $4.5 million in the third quarter of 2021 versus $3.3 million last year. Margins are running around 76% year to date for combined product and service revenue. And skipping down to the balance sheet, you can see that our cash on hand is $28.5 million compared to $18.2 million a year ago. And we have 23 million shares outstanding of common stock, no other issuances other than common stock.
Great, Brad. Thank you so much. So just to touch briefly, we have we think is an exceptional leadership team here. We have a team that's experienced in bringing products to market, experienced in executing for results, and widely acclaimed in the dental industry, known throughout the dental industry, known throughout the sleep industry now. And so we feel like we have a very good board of directors as well. We have people with extensive public company and government experience, as well as just having executed and done well in various aspects of life. So we have a strong board of directors, a strong management team, and we're happy to take some calls and answer some questions. Brent, if you want to tee something up, happy to do that.
Yeah, I would love to. We had a really good question here. How is Vivos targeting and marketing to the potential patients that suffer from sleep-related issues that don't go to the dentist's office?
Well, that's a good question. So we actually our focus is the dental community because that's where the technology gets delivered.
Sure.
We have a parallel track that we run down where we call it our medical integration division. Okay. And we are, because of our go-to-market strategy where we've introduced the sleep image technology, we're getting phone calls. I was on the phone yesterday with one of the largest cardiology groups in Nevada. We've got large cardiology groups and other specialty groups throughout the country, hospital chains that are calling us saying, "Hey, we want those rings. Where do we get the rings?" Sure. So in effect, the folks over at Sleep Image are a very small company. They do a great job with the technical support, but they don't have a big sales force. So Vivos has been out there leading the charge, and we're just coming across a lot of physician groups, a lot of hospital groups that know that sleep image is a fundamental challenge for all of their specialties across all of their the work that they're doing for patients. And so we're getting inquiries across the board. So right now we're not directly, other than on social media, we're not directly going after patients that are not part of the dentist. But one thing that I would say is that over 280 million people go to the dentist on a regular basis in North America. So we're capturing plenty of mind share out there with what we have today, and we'll continue to to go after the medical community as we go forward here. The medical and dental communities need to collaborate, and they need to come together to work on the optimum outcome for these patients.
Gotcha. Excellent. So we did have a couple other quick questions, but we're kind of up against the clock here, gentlemen, unfortunately, but want to thank you a ton for joining us today. Kirk and Brad from Vivos Therapeutics. It's ticker VVOS on the NASDAQ. Thanks a lot, gentlemen.
Thank you.
Thank you, Brad.
Have a good day, guys.
Yep.
Thanks, you too.